today's my guest and an interview is Dr. Richard Cheng. I'm giving the ball to him to short biography, and then I want to ask you how you ended up going to Wuhan or China when all these things happen. Just give us a little short introduction, and we will
Sure.
go to the scientific questions.
Yeah. You want me to talk right now?
Yes, go ahead, please. Yes.
About how? Okay. Yeah, actually, yes, that's very good. I'm glad that I met a fellow AFOM member. I mean, member friend. You know, that's very good to know. And yes, actually, well, I went to medical school in Shanghai many years ago. Went to US 34 years ago in '86, and this time I came back to spend the Chinese New Year with my parents, and also invited to talk at a few conferences, like integrative medicine conference in China. And so what I didn't realize was that that was only 10 days away from the COVID-19 breakout. And so when the epidemic broke out, I debated whether I should evacuate with the U.S. Embassy because they were offering assistance. But my parents are here, and they are in their 80s, and I decided to stay with my parents, making sure, they survive this episode, which happened, they are doing well, everything. But so like you said, AFOM is good. It covers a lot of, areas in medicine and also vitamin C, but not as much. But in AFOM, I also got in touch with some other people, including Dr. Thomas Levy, and he doesn't go there much anymore now. But so I came to know about vitamin C probably more than the other anti-aging or functional medicine doctors, and I really studied it and literature and everything. I really believe this is a very important piece in our overall health. And I translated a couple of books of Thomas Levy and others as well into Chinese because I feel the public should know about it. So when the COVID-19 broke out, I immediately came to my mind that vitamin C should be the way to go. At least that's very powerful, effective in helping preventing and treating viral infections. That's how it got started, and the rest, right now it's still ongoing. Right, every day I have some interviews. And
so one quick interruption here. I'm gonna play the devil's advocate here. So I'm gonna tell you from the mindset of physicians in contemporary medicine, how come a vitamin C is gonna help viral infection? What is the mechanism or mechanisms of action? Can you just give us like the introduction to 101 vitamin C and convince me that I should use it?
Yes. Now, first of all, vitamin C has multiple biological effects. Okay, there are books on this thing. Yes. But here for COVID-19, let me just go straightforwardly. Vitamin C has direct and indirect antimicrobial, antiviral effects. So vitamin C has been proposed to, we know vitamin C increases the production of hydrogen peroxide in our body. Okay. And hydrogen peroxide is a powerful antiviral agent. And that's what we know for sure. And the vitamin C also directly boosts our immune system. Vitamin C is very high in leukocytes, in lymphocytes, and these immune cells. And these immune cells carry vitamin C to the infected sites. And the vitamin C is also involved in gene transcription in the epigenomic regulation. So, in a nutshell, as you mentioned, yes, vitamin C in the basic research has direct and indirect antiviral effects.
So
that's the mechanism.
Quick actually addition to here. Did you hear about Dr. Oliver in 1918 in pandemic of Spanish influenza? This doctor in India, as you know, diluted hydrogen peroxide and treated the patients, 100 patients given to him. I think they expected 100% them to be dying and then saved the lives of 50% of it. So it's
well, actually, I didn't know that.
Yes.
Can you send me some link of this?
Yes,
because that's important. Because
it's been published in Lancet, and I have the full Lancet article. I will send you the full Lancet article.
Oh yeah, please, yeah.
February, well, that's important. February of Lancet article, yes. 1920.
Yeah. So that's Dr. Oliver. Okay, so was that by IV or by breathing?
IV, and what he did was like he used 1 to 10 dilution of like a 3% or 2% peroxide pharmaceutical grade, and then he did in a very, very slow infusion to prevent embolization, or just because, as you know, there's a risk over there. And then he was successful, and then he has the full recipe in that article. We can just easily replicate that. Actually, before this, I did a Turkish YouTube through the Turkish local Turkish channel here, and then I proposed 4-prong approach to coronavirus, and then 4-prong approach to treatment. And one of the treatment, of course, I put on the very top was IV vitamin C. Second thing, I said, let's consider hydrogen peroxide. And third one, I said, let's consider ozone therapy like Dr. Rowan did it in Ebola cases. And fourth one, I said, let's not to forget evacuation pathways and then stimulation production of glutathione through coffee enemas. So those are the 4 treatments I have recommended. I still insist on it. If they do these 4 things, I believe no one will die. Right now, right and left, people are dying and nobody listening. And nobody have the guts to give option to give me like 100 patients that you know that they are going to die tomorrow. I will do these 4 things and I will save all of them. I can tell you this much. If not 50%, like
I agree with you.
So
yeah, I agree with you. Actually, I also recommend, I am, well, because of a case in the past, I recommend nebulizing hydrogen peroxide. And actually, just this morning I tried out. Well, because in the state of South Carolina, where I practice now, about 15, 16 years ago, there was a doctor administering hydrogen peroxide IV and for cancer treatment. And then eventually medical board sued him, and he spent a few years in jail. So that really gave a bad, you know what I mean.
I think we are days of nanotechnology, and I have a brother who's an integrative physician, collaborates with the physicians in Germany. He lives in Istanbul, Ankara, and works in Istanbul as well. But he has very good results with colloidal silver, actually, in a nebulizer format. So he's using.
Well, actually,
Go ahead.
Let me stress, Dr. James. I forgot his last name, Dr. James. He didn't do any harm to patients. Keep in mind, there was no side effects. There was no anything. It just didn't. The medical board didn't like him.
Yeah.
And he wasn't, the medical board sent him warning letters, this and that, and that's a little bit early, I guess he didn't, tie up with a group of an organization to support him. It's like FOM.
Yes.
FOM offers legal assistance in case, because we're all in a sense of alternative medicine, not the orthodox contemporary medicine that the drug-based. So we have to advance medicine, but at the same time we need to protect ourselves.
In old days during the wars, where they had the calamities, most of the techniques in surgery and most of the new treatments has erupted. This is like a best opportunity for us to get these things tested and then find the best way of medicine. Did you know that last month, actually, the Times magazine, last month for us, for you, but I'm still in the March of 2020, Times magazine had a special issue, and it said alternative medicine is the medicine of the future, and had a full special issue. So it's time now. I think it's time to this reborn and get it advanced. So I'm very excited to have you here. But let's go back to your history, and how did you end up starting using IV, and then start telling us your protocols, your experiences, and then if you have a chance to restart today, what would you do? What would you do different than what you have done then?
Yeah.
Okay, go ahead.
Okay. Now, before I answer that, can I add to something? You're absolutely right. I believe out of this tragic COVID-19 pandemic, something good will come out of it, which is the not fully, but somewhat recognition worldwide by the public of the vitamin C, and also, what vitamin C represents. Vitamin C, in my view, is the 38th line of the DMZ. Is the fighting point between the alternative medicine and the contemporary medicine. And so actually, I'm in the middle of writing a book on this. I want to finish it by publish it before the end of April, because taking advantage of the worldwide attention on the vitamin C and COVID-19 and about vitamin C, I want to expand what vitamin C represents. It's not just about antiviral.
Okay.
Vitamin C is about antioxidant, about collagen synthesis deficiency, and collagen synthesis deficiency and oxidative stress play essential role in all chronic diseases, including diabetes, coronary artery disease, and cancer. So that's my view. I mean, so that hopefully people, through vitamin C, people will get to know about the essence, the true causes of these chronic diseases. And that's what A4M or also molecular medicine or functional medicine is about. So I think that's a good opportunity.
Yes.
And so coming back to your question. So, I happened to be here in Shanghai when this thing came out. And over the past couple of years, I've been promoting the A4M concept, anti-aging functional medicine concept. And one of the key focus is vitamin C. And among other, dietary changes, antioxidants, and leaky gut, all the other things. So I know about vitamin C, and also through my presentation, I've been invited to, actually every year. This year I'm supposed to attend a couple of national conferences here in China and present, but now it's of course all canceled. So when this thing came out, I got together with some of the medical leaders in this country. Like in any country, like yourself in Turkey, there are these medical authority leaders, and they believe in the true medicine. So we formed an international IVC medical support team. That includes some international, medical experts on vitamin C, and also the Chinese experts on this thing. So we started calling for doctors and the public and the leaders to explore this vitamin C. I even volunteered to go to the epicenter in Wuhan. I didn't go to Wuhan, and the reason for that is because of my citizenship. I'm a U.S. citizen, and as you noticed, this epidemic actually is more than a medical thing. It's more of a political and diplomatic issue. The diplomatic tension is pretty high. So basically, and we've been making through private and public channels, sent our requests and our proposals to top. There's a national expert team that's by the central government in Wuhan, and I reached that team through 2 members, and I sent my proposal in. And we also reached the top authority in a couple of governments, including that of Shanghai. We sent our proposal in. So, with all our literature, references and everything, convincing them vitamin C is safe. Even at very high doses, like in cancer treatment, it's very safe. Yeah. And vitamin C, there's enough research to show basic and clinical studies to show vitamin C is effective in antiviral prevention and treatment. And so there's no reason to not use vitamin C. And to answer your question earlier, play the advocate of the devil, is that we don't have any better treatments for COVID-19.
Yes.
For God's sake, let's try everything that's possible, and let's try something that doesn't harm people, right?
Yes.
Vitamin C, like I said, on NIH NCI's website. We don't have to talk about all these review articles in literature. Let's use some authoritative documents. NIH, that's the world's recognized medical authority. NIH has a PDQ, Physician Data Query. Okay. The last update was December 4th of 2019, 4 months ago. it clearly states in the document that high dose vitamin C usually does not cause significant side effects to people.
Okay.
And high dose, we're talking about 100 grams of vitamin C.
Okay.
Basically, like 1.5 gram per kilogram body weight. Very high dose. So vitamin C is very safe. So when it's safe, then we can use it without much concern.
Okay.
Of course, we have to justify. And also, like I said, there are a lot of literature that supports that vitamin C is able to kill virus. And lots of research to show vitamin C, IVC, can shorten the ICU stays, can shorten the symptoms of viral infections, and can prevent common colds, for example, in the general public. So there's no reason not to use vitamin C.
Yes.
So that's my way. And that's how eventually, actually, you begin to see a lot of places, because all it takes is just maybe one place.
Yes.
So in China, so there's one first IV vitamin C high dose trial that came out. Then other doctors are more willing to try. See what I mean? The first person who tried it, and then more and more. So in China, there are at least 3 registered IV vitamin C clinical trials.
Okay.
And also Shanghai used the Shanghai team used high dose vitamin C in the treatment of COVID-19. Okay. And both Shanghai and Guangzhou governments, these are 2 out of the 4 major cities in China. Both governments of the city recommended high dose IV vitamin C in the treatment of COVID-19. Okay, this is official here in China.
Okay, and then how much is used? Like one may recommend, but some adoption takes slow curve. Some goes like this. So, what is your observation? What is the adoption rate?
Okay, so far the doses have been still on the lower side, in my opinion.
Okay,
but better than nothing is good enough, I would say. So basically, the dosage have been around the 10 to 24 grams.
Okay.
The highest dose that we're seeing here is by the first clinical trial by a central China hospital in Wuhan.
Okay.
And that protocol calls for 24 grams of vitamin C in 24 hours. Okay. That's the highest dose we saw.
Yes.
In Shanghai, they use high dose. They use IVC for moderate to severe COVID-19 patients with a dose of 10 grams in every 12 hours, either once or twice a day. So moderate cases they may use.
Connection was lost at the point when you were saying that moderate cases 10 gram, severe cases like 20 gram was in Shanghai. So we got that part. So I know from your videos you mentioned about 50 of these out of 360 patients, they all left the hospital 3 to 5 days before.
That's right. That's right. Well, going back a little bit, actually.
Yes.
So there was one case, at least one patient who received a much higher dose than 20 grams.
Yes.
There was one patient, a senior person, deteriorating pretty rapidly with pulmonary respiratory distress, and this patient received 50 grams vitamin C bolus in 4 hours. 50 grams in 4 hours, and the patient was literally in real time showing improvement of oxygen saturation as the vitamin C was being dripped.
Okay.
So we do know there has been cases where up to 50 grams or more used, all of those 50.
Yeah, I have heard anecdotal cases from physicians who used themselves up to 70 gram when they had X-ray proven pneumonias. In one dose, they all got better, and they had X-ray clearance on it as a proof and a clinical improvement. So I believe what you're saying now.
Yeah. Well, actually, Dr. Cathcart back in the 80s, 90s, they used to use much higher doses. Compared to those doses, our doses are very small. Actually, I did vitamin C for myself. I'm perfectly healthy.
Yes.
2-3 days ago, I gave IV drip to my parents, my sister, myself, all of us. Everybody received 20 grams.
Yes.
These are all healthy people.
Yeah.
Okay, everybody was happy, dandy, no problems. So what are we worried about? I mean, not that I routinely receive for anti-aging purpose, and of course I was trying to show people don't worry about side effects. I'm doing it myself, you see.
But the question is, G6PD comes always. When do we need to worry about G6PD deficiency? And
what we actually, that's a good question. And G6PD is an enzyme deficiency, and when you don't have the enzyme, then when you're giving vitamin C, sometimes we may see hemolysis or blood lysis. However, when it's a low dose, I mean, the treatment for G6PD actually is glutathione reduction.
Yes.
So we propose for these people, actually, if we give them a reduced glutathione and then IVC, then we should be okay. So my approach has been to, even for people with G6PD, there's a paper, there's an article by America in the literature actually recently, last year I think, is that for people, for IV vitamin C lower than like 10 or 15 grams, you don't have to worry about the G6PD.
Okay. I know that article. So 10 to 20 to 15, you don't need to even worry. But over that, there's a new way of doing is glutathione. Maybe you do bolus of 1 or 2 grams of glutathione first, and then give the vitamin C. Nothing will happen.
That's right.
And then
exactly, because
is in a high prevalence for G6PD, like the North Africa, because of
Mediterranean. Yes,
that's the reason.
That's right. Yeah.
Okay. Mm-hmm. All right. So
I see. Yeah, it will be still safe to test them. And for those G6PD deficient patients, you want to maybe ramp up a little bit more slowly, monitor more carefully, because if you do have to use, you still use it. You can still use it.
I mean, there are studies showing that over 24-hour drip is better than like boluses sometimes for chronic diseases. What is your recommendation? 12-hour drip versus push, or do you recommend the same thing for very sick patients, like 50 gram, like you guys did it?
Yeah, for COVID infection of COVID-19, actually, they are both important. We need to have a peak concentration of vitamin C for its pro-oxidant effects, for its hydrogen peroxide induction effects. But we also need a continuous presence of vitamin C. So I would usually like to give a bolus of vitamin C and followed by daily drips.
Okay. Daily drips. So this will be the best protocol. Now, how the patients did it in Wuhan? I know the patients' data you shared in the YouTube's for the Shanghai patients. Do you have some input from your colleagues there, and can you give us some sense?
Going back, actually, let's talk a little bit more about this. One of the, we know about the COVID-19. COVID-19 is lethal for some patients. Mechanism for that is the cytokine storm, or the exuberant, significantly increased oxidative stress. Yes. And so for this, we need a lot of antioxidants. And vitamin C is one of it, and other antioxidants, including what we've been discussing, glutathione. So lots of abundant or sufficient amounts of antioxidants is the way to deal with this cytokine storm, or ARDS. Yes. Now coming back to Wuhan, yes, when the high-dose vitamin C was administered, they did see a significant reduction in inflammatory markers and patient improvement. The data, of course, because it's a clinical trial, it's still being analyzed and being reported. And because of the shortage of some patients, actually, they were not able to enroll the number of patients they desired. So the study design has been changed to some degree. And some of them has changed to like clinical case series rather than a double blind control.
Yes.
Yeah.
So, but overall, the results were positive, and then they were
yes, that's right.
extubated faster. Is that the usual?
Hospital stay is shorter, yes. Shorter. They were out of the ICU faster. They were out of the hospital faster. For example, the Shanghai 50 case series saw about 5 days shorter out of 30 days in the hospital. So average people would stay about, basically the way the criteria here in China is that these patients have to be negative by nucleic acid test.
Okay.
So even though their symptoms may be gone, but if they are still positive, they don't go home.
I see.
And so these patients average would stay in the hospital for about 30 days. But the IVC group stay on average about 25 days.
So let me ask you this question. Right now, the biggest concern in US, and especially in New York, is shortage of ventilators. So can we easily say that we can shorten the ventilator time with IVC on these patients and maybe save more lives? Because right now they are deciding who to take out of the machine and put the next person in if they come to that point.
Yeah. So, well, actually, my way to approach this is that we need to intervene early.
Yes.
Don't wait until you get to the moderate or critical stage. Actually, I would say go even one step further. Don't wait until we catch COVID-19. Start taking your oral vitamin C.
What's the dose?
What's the dose? Well, actually, here's how I usually prescribe. For average person, like myself, actually, I take about 10 grams a day. That's 10,000 milligrams of vitamin C daily. That's for average person.
Yes.
Now, for somebody, if somebody starts showing like a cold and a viral infection, like a sneeze, cough, sore throat, or even a low-grade fever, then I would say take 5 grams of vitamin C right away, a bolus,
okay,
to saturate your system. Then take 1,000 milligram or 1 gram of vitamin C every hour.
Okay. Now, does it
1 or 2 grams actually.
Ascorbate or ascorbic acid, does it matter, or which form?
It doesn't really matter either which one. And usually I prefer the ascorbate, the vitamin C acid. Okay. Of course, on the market, usually I usually use either sodium ascorbate or ascorbic acid. The sodium, one of those two. But I prefer just the acid version. Yeah. Because of its acidity, it helps our stomach as well.
Okay. So basically, what have they done in Wuhan or Shanghai for the healthcare workers? What is the approach there? Did they use your recommendation, and then did this help to healthcare workers? Was there any positive response on that?
Well, what I can say is because of my public appeals for vitamin C use, let me take it back. I shouldn't give myself too much credit.
No.
Let me say that I have been making a lot of public appeals, and also I have been sending vitamin C powders to some of those healthcare workers. What I did notice was that more and more of those volunteer, or not really volunteer, but government called medical support staff, nurses, doctors, when they were packing to go to Wuhan, they packed vitamin C in their suitcases.
Okay.
That much I can tell in at least Shanghai. Almost everybody's necessity was vitamin C. So I would say I think I did help in some way. And I think actually this is a great study I've been calling for, if possible, is to recently I published an article just a couple of days ago on the medicine in drug discovery. It's editorial. I call for healthcare providers to take high-dose vitamin C orally to prevent from catching. I mean, actually, I recommend all high risk. I recommend everybody take it, but at least for high risk groups, including healthcare workers and maybe senior citizens and immune compromised people. And if we can also analyze the data, that should tell us, because we know there are a lot of studies out there, vitamin C can prevent people from catching cold.
Now,
yes.
One thing I want to input here is give credit to Dr. Russell Jaffe. He's one of our mentors in A4M. As you know, he talks about C flush, and then he has his company Perk promoting the ascorbate version of the powder and the capsules, and the one way to know actually how your immune system or how much garbage you have is test your body with a C flush test, and then like and then with test I can tell actually how sick you will become with the COVID if you get it, because the more vitamin C you require at the beginning of this C flush test, the sicker you are inside and more prone to get the COVID-19 as a like a worst case. So one thing that he recommends, like, do the flush test. Basically for our viewers, it's like you get a powder vitamin C. Each tablespoon usually has 3 grams. You keep taking 3 grams every 15 minutes until you go to bathroom explosively, and that is your is like the maximum tolerance. It's got gut tolerance, and then 75% of that he recommends at least a month to clear all your like heavy metals. And then, as you know, vitamin C, another good effect, increasing glutathione and then clearing the heavy metals and then toxins. So basically, I think for your study, I can put an input that let's do a bowel tolerance test for everybody, and based on that,
exactly,
appropriate amount.
That's Robert Cathcart's theory, and we call it VC flush.
Yes.
And actually, I have personally been treating a few patients with COVID-19. I do see that these patients do have a much higher tolerance than we do. Yes. For me, when I take 10 grams of vitamin C, I will go back through.
Yes.
And on the average, for most people that I have seen, average people over my many years of vitamin C usage, that most people would develop a water diarrhea or flush with probably 10 to 15 grams.
Yes.
But I do see a few occasionally people may require 20 grams.
Yes.
However, in these COVID-19 patients, and I have them taking 30, 40 grams, 60, 70 grams without diarrhea. And recently, I have been consulting on a Chinese student in Germany, and she was very scared, a young student alone in Düsseldorf, Germany. And she says Düsseldorf is the most severely affected city in Germany.
Yes.
And she felt she probably got contact with a COVID-19 patient, so she started developing these symptoms. And for the past 2 weeks, she's been taking a lot of vitamin C. She's been taking about 40 grams and didn't have diarrhea. When she was taking vitamin C, she felt better. But when she, if she skips a bit too long, she starts feeling bad again. And so these are typical reactions. COVID-19 seems to linger longer, unlike a common cold. Yeah. A common cold, usually I ask my patients, take vitamin C flush. If you flush, just one day, usually the next day they'll feel much better.
Yeah.
But COVID-19 seems to be a little bit more severe.
We had a friend, actually, a family friend who's a nurse in the frontliners. She recently had a baby, and then she called frantically my wife saying that she was actually sent home with fever and laryngitis, loss of voice, and she was in tears what to do if she dies. And then I just taught her actually how to do the flush, and then it took her only like 2 days to recover it fully. Now she's 100% better.
Yeah.
It's amazing.